So hello everyone. So I am VC Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the remaining parts of the low back pain. So in the previous video, you have just see the definition, causative factors, and the symptoms for the low back pain. So now we're going to see about how the physical examination has been done in the low back pain cases. So generally in low back pain cases, the physical examination is done in the standing position. The following observations are made in standing position, sir. Position. Normally, a person stands in erect and the center of the occiput in the line with the natal cleft. The two shoulders are at the same level, lumbar hollows are the symmetrical, and the pelvis in the square. In the case with a back pain, look for scoliosis, kyphosis, lordosis, pelvic tilt, and the forward flexion of the torso of the lower limbs. In these conditions, this shows the patients have been in the changes in their back region. So these are the pictures which shows the abnormality in their back region while in their standing position. So second, it also shows the spasm, tenderness and swelling and the limited range of motion in the back region. So this is the bending at the spine and hip level, and the second picture shows the bending alone happens in the hip region. So it clearly shows the two difference between the pictures. In the first picture, the whole spine is bending down using to bend down, and the second picture shows just the person is using only hip to bend down. Second one is in lying down position. So generally the patient is measured physically examined by using lying down position. So in lying down position we have examined by patients by using, I used to call them a straight leg rising test, and it also shows the whether this straight leg SLR test helps to find out whether the nerve root is getting affected or not. In the neurological examination, it shows the sensation, motor power, reflexes of the lower limb which are examined. This helps in localizing the site of spine pathology. Peripheral pulses, it also shows the peripheral pulses. It also helps in find out the adjacent joints abnormalities, and it also helps in find out the abdominal, rectal and pervaginal examinations. So now we're going to find out how the patients have been investigated or else diagnosed whether the patient is affected by the low back pain or not. So generally, if a person is affected by the low back pain, we generally using radiological findings, and particularly first we go for an X-rays. So in X-ray, it shows the bone structures and identify fractures, arthritis and spinal misalignment. And second one, it shows MRI. MRI shows whether the soft tissue is involved or not. In the third, bone scans. In these bone scans, which is used to identify the patient is getting infected or else patient is getting fractured or the spine is affected by in the cases of tumors. The electromyography, which is also called as EMG, which is used to measure the nerve and muscle electrical activity to access the nerve damage and the compression, which is conditions like sciatica. And the fifth one, blood and urine tests, which shows whether the person is getting infected or whether the person is affected by the inflammatory conditions such as ankylosing spondylitis or other systemic diseases. So now treatment. So generally, if a person is affected by the low back pain, so the treatment is according to the first we move on to the conservative treatment. The conservative treatment shows the, so along with rest, the person is also prescribed by using drugs, hot packs, and spinal exercises, traction, corset. Corset is nothing but the braces or splints which are used to maintain the low back in the straight aligned posture, and educating regarding the prevention of the back pain. So first, in the acute phase, the patient is instructed to take rest. So absolute take rest on the hot bed, which is bed rest for more than 2 to 3 weeks of no show. Rather, the gradual mobilization using aids like braces is preferred. So next, they have been prescribed by the drugs. If the patient is affected by an inflammatory conditions, the drugs mainly prescribed for them is analgesic anti-inflammatory drugs, which helps in treating the stiff spine, and muscle reluctance also used to prescribe them. Physiotherapy. So according to the physiotherapy, hot packs, shortwave diathermy and ultrasonic wave therapy, which helps in the reduction of the pain, and the gradually spinal exercise program helps in the regaining their muscle power at that region. The traction helps in the patients with who are being affected by the muscle spasm. So the use of corset, this is used as a temporary measure in treating acute back pain. In back pain due to lumbar spondylosis. Education. Patients must be taught that there can be an alternative for the pain and to avoid the injury and re-injury to the back. This includes education to avoid straining in the back activities and the daily living, such as sitting, standing, and lifting the weight. So this is the complete protocol and the phenomena which have been used to treat the low back pain. So hope you guys have find out some of the knowledge in this video. So thank you. See you on next video.